So before that, the benefits of age-friendly care. So it enhances that quality of life and well-being. It improves the patient satisfaction and outcomes, enhances collaboration. So this is like the shared decision-making. So this is you being part of your care plan, your treatment plan, and we'll explain a little bit more. And then it aligns with that whole person-centered care. So what matters? So this is actually, this information is taken from the IHI website. There's an abundance of resources and educational things for anyone that is free public domain. Anyone can go log on and see what it's about and what other services they have. But when it comes to the resources, I've just listed a couple of just two or three for each slide because there's a lot more that I would highly encourage you to go look. But what matters? So this is the core of age-friendly, and this is the core of the 4 M's. So without what matters, the other M's don't matter. They do not matter. But what is what matters? So as we age, we know that our needs will change. So what you might needed yesterday might not be applicable for today, right? So applying that to your health care. What you might want out of your doctor's appointment might not be what you're wanting when you're in the hospital. Because typically most folks, when they're in the hospital, we want to go home, right? We're busting tail to get out, right? But so this is important for you as the patient to share your concerns, your goals, your wishes, your care preferences, not only to your medical providers out in the community, but also in the hospital. The resources available. So this myhealthpriorities.org, this is actually, I used this the other day, I looked it up, but this is a wonderful online tool from Patient Priorities Care website to identify what matters most to you and your health priorities. This is an interactive, that's the website. If you go there, there's also other resources, but this is really like step-by-step online that you can complete with you and your loved ones, and you can print out your summary afterwards when you're done. It takes, I think it said about 15, 20 minutes, and you don't need to log in. It's simply, you can just go on and do it without having, I guess, a guest log in is what you would call it. The next thing is the Conversation Starter Kit. This is a guide to talking with your family about what matters to you at the end of life. Nobody wants to talk about death or dying, but unfortunately, as we age, it's inevitable. But one of the things that you could do for yourself as well as your loved ones is if you, gosh forbid, if you have to come to the hospital and you're not able to make decisions for yourself, this is a wonderful guide to show you how to talk to your family about having this talk and what are your wishes. Like an advanced directive, living wills, things like that kind of fall under that. But this is the conversation starter. So how can we talk to our loved ones about this? So for the second M is the medication aspect. So how does medication impact us as we age? Well, we know that a lot of older adults have probably 5 or more medications that they take a day. And when I mean medications, this can be prescribed over-the-counter or herbal medications. So when we have a higher usage of medications, there sometimes can lead to side effects. And not what is those side effects is pertinent and based off how you age physiologically. Some drugs may affect us in what new ways that, let's say, for example, if we were taking hypertension med 2 years ago and we're controlled, as now we're aging, our body's changing, it might impact us now than when it did 2 years ago. So paying attention to your symptoms and your signs when you're taking your medication is a good thing to start. Like bullet 1, talk to your care team about any side effects that you may experience. So that's kind of an example. You want to ask your care team how to assess your medication and how your medications interact with each other, especially if you're taking multiple medications. And then this is probably the most important bullet. A lot of individuals do not realize that over-the-counter medicines and natural remedies is also considered a medication. And so when I see patients in the hospital, I'll ask them, what medicines are you taking? And normally, most of the time, folks will tell me the ones that are prescribed, right? But you would be surprised the amount of natural remedies that can interact with your prescribed medication, and you might not know it. But again, the IHI website. So there's other resources, but these are the two that I thought were really beneficial for this presentation. Is that the 10 medications older adults should avoid or use with caution. And then this is the one I highly recommend. I actually have my grandparents. I printed this out with them a couple of years ago, and so the tracking your medications worksheet. And that's on that National Institute of Aging. And again, so what I'll do is I will send these links to Lynn, and then have them, I don't know, maybe we can print them out or something. That way you can have them available to you. But if you would, you can also just go to ihi.org, and that will also lead to IHI. Yes, ma'am. And that will lead you to a lot of these resources as well. For the third M, it's mentation. And mentation is your, like how your brain works. How so this can impact, so like dementia, Alzheimer's, or chronic cognitive impairments. You have depression as well as delirium. And delirium is considered a medical emergency. And that is when you have a sudden onset of confusion. So what can you do as the patient or loved one, care partner? You tell your medical provider if you notice any changes in your memory or mood. You should be getting screened for dementia and depression each year through your primary care. If you're not, ask about it. Those are typically the questions they might ask you for your cognitive status would be, they tell you 3 words and then they'll have a conversation with you. Are y'all familiar with that? Or the clock or something like that? Okay. So yeah, so if you're not getting screened, you need to tell your provider, speak up for yourself, because this should be happening. And then again, if you become confused suddenly, or anyone becomes confused suddenly, again, that's a medical emergency, and you should be seeking help. There's some resources here. So this, again, is all through the IHI website, but there's the Alzheimer's, because I know we have the prevalence of Alzheimer's and dementia within our community. And then aging help, healthy aging tips for managing delirium into older adults. So older adults are considered higher risk for delirium in the hospital setting, especially after surgery. So the goal for the surgery services is to get you up and moving and get you home, back to where you feel safe. Not that you're not safe in the hospital, but we all want to be home, right? And then there's the older adults and depression, and learning the signs and finding the treatment, because I know there's a lot of folks, not just older adults, everybody in general, there's a lot of folks that don't know the signs of depression, and you can have depression and not really know it. You know, you're just trying to trick through life. So I recommend looking at that as well, if that applies for you. So I'm going to go over the last M, and then I'll stop and just for any questions, okay? Because I know this is a lot. So the fourth M is that mobility, and it means by being mobile. So what you can do is have that, again, talk to your care providers about how you get around at home and how you go from place to place. What's not working and what is working, you know, because they don't know. Again, you're the best advocate for yourself. You're the ones that can tell us how we can help you. Ask about how you can improve strength, flexibility, and balance. So we know that working out, any type of working out can build your muscle tone, which helps support your bones. And then check your home for objects that you can trip on or missing handrails that can cause falls. So these are just examples, because our elderly are at high risk for falls, especially at the house. And there's a significant increase for patients that have one fall that will happen again. So some of the resources for this, if I had to, of the 4, I would recommend really doing that falls free checkup. Again, I used this for my grandparents and kind of went through their house with them, and I was like, all right, okay. I think my grandmother was a little ill with me after that, but it worked. And then move your ways tools, videos, and fact sheets. So some folks just don't like reading. There's also videos and tools that will help with that as well. So let me stop here, and let me just ask, does anybody have any questions in regards to kind of what we went over? I know it's a lot. Okay. Then I'll keep going. So if you haven't heard me speak about self-advocacy and why this is important, why it matters, well, we know that it has different aspects, but at its core, it's about actively participating in the decisions about your health. Practicing self-advocacy can help get you the support and medical care that you need, which can lead to better health and outcomes. So when I talked about the what matters M, that's how this drives the rest of the M's. So sometimes self-advocacy is hard to do, right? But this is kind of a little screenshot of like tips of what you can do. So recommend bringing a supporter, whoever that supporter is for you at all of your medical appointments, as well as if you're hospitalized. Explore other options. So just because what somebody once says doesn't mean that it's always the right thing, correct? Practice, and I'll talk about that in a minute. Come prepared, that goes with the practice. Be open and ask questions. Ask what's most important to you, and we'll talk about that. So we have some examples to help with that. And take notes, which I see a lot of y'all doing. Let's see. So what are our key takeaways from this? So we know that age-friendly care focuses on optimizing health and well-being of our older adults by talking about the what matters, again, which is the core of age-friendly care, and it anchors the other M's. How you can practice and practice is using the self-guided toolkits. This will be able to give you kind of a platform of when you go into that medical doctor's office. As we know, that's time sensitive. We have a certain amount of time blocked that we can see a provider, so we might not be able to get everything that we need addressed. But this is a good way to kind of give you that visual and keep you on track of what your actual main goals are for the purpose of that visit. So let's see. I know there is I'll give some of you. So what we might do is just kind of share who has, is it the health checklist that we printed out, Lynn? Okay. Okay. So what I'm going to do, because there's limited copies, I'm just going to kind of pass this around. If you have one, you can kind of share with your table. But this My Health Checklist, this is the packet that I was talking about. So there's two packets. I apologize. So there's this My Health Checklist packet, and then there's this Your Conversation Starter Guide. These are printable. I highly recommend printing this out and kind of going over it. I'll just briefly talk about this one real quick. This is this Conversation Starter Guide is how to talk about what matters to you and how to say how they say in your healthcare. And this is really specific to your end of life preferences. So I'll pass this one around to kind of look over it, but the one I'm really going to talk about is the My Health Checklist. Here you go. Oh, yes, ma'am. So this is, again, through the IHI website of the John Hartford as part of the Age Friendly Initiative. My Health Checklist is a guide to help you prepare for your medical appointment. So this is kind of throughout this whole training I've been talking about, really preparing and being that self-advocate, playing that self-advocacy role. This is a way to do that. So I think it's 12 pages maybe, but what it does is it breaks it down on how you can focus on those 4 areas and how you can think about your health. So for the what matters to you in your life, or it can be what matters for the purpose of this visit, it kind of breaks it down for that. The My Health Priorities website is another way too. That's just the online version. This can be printed out and taken with you as well. It gives you tips for completing the guide, and I'm going to show you some of the questions. And the good thing about this, you don't have to complete it all in one time. You can sit down and do 2 minutes of it, however long you want to spend on it. But so this is kind of what it looks like. The age, what matters, talks about what's the most important to you, what you enjoy the most, and this helps you think about what's most important for your health. So your situation right now, what are the most important things to you in your life right now? So some of the examples that I've been told in the hospital when I ask patients this, surprisingly, which this was news to me, there's a lot of older adults in Moore County that actually take care of their grandkids. And they babysit them, or they actually, the grandkids live with them. And so one of the goals for a patient of mine was, I need to go back home so I can take care of my grandkids. That can be a goal for you, right? It has actually, and it does have some ideas for you as well. So this says being regularly in touch with the people I care about, adjusting to retirement, experiencing grief or regret, because unfortunately the age that we are, we do experience death. We lose a lot of our friends and family members. And so this can help with that as well for your next visit. And then the feeling anxious and worried and what may cause that. So those are some of the ideas that this packet gives for you. Another question it will ask is what's going well. So what is helping you thrive and live without your community? What brings you happiness? So is it babysitting your grandkids or being with your grandkids? One of the examples is involved in my community. Golfing. Yes, ma'am. So do I need to print out like a copy with all the resources on it? Would that be best? Yeah. Here you go.
The HR, not HR, IT knows every single department, and then there's this list that comes out every month. So they're like, we'll put us on that list, so that the whole county will see we're spending all that money because we're spending the money. So I think
Yeah.
it has limited amount. I certainly can print out, maybe if there's 1 page or 2 pages in the 12 pages that's the most important, I can try to print that out with the resources that Stephanie sent. Maybe you could put that in the next week, with how to get to the site. Oh, okay.
Yeah.
Well, we can do that with a sheet too. We can have it available in the lobby, that has all that.
Yeah, so I'll do that, Lynn. I'll actually create a little Word document that has the actual links to everything, and then you'll be able to print that. Is that okay? Yeah.
Stick that in the lobby, and then you just come to the front desk and say that you came to the Firsthealth talk, and that you would like to get that 1-page printout, and we'll have them available for you.
Oh,
Okay?
perfect. Thank you. Yeah. Okay, good. She got it. So again, because this is a new journey for us at Firsthealth, really incorporating those 4 M's. I mean, we do the work, but it's actually integrating it all across the system. So I'm working on creating an age-friendly care webpage coming soon. And that will also have the available resources. So when that's up and going, I've already talked to Lynn. I will send her that, and that way y'all can have the link to it. And then it will have these links outsourced to it as well. Some of the resources that we have available in Moore County, so the Aging Outreach Service, and Lynn's going to talk a little bit more about some of these services, the Moore County Senior Services here, and then the Pinehurst Area Alzheimer's Association. And then I just thought that was cute because we know. Okay, so I'm going to stop here for questions. Any questions? I know it was a lot. I apologize. Yes, sir. Mm-hmm. Yes. So, yes. So let me just hand the mic to you. So he was wondering about screening for dementia and if the primary care will do that. So, thank you. And then what was your second part of that?
Second part of the question was, are primary care doctors agreeable to authorizing a test for dementia or other sorts of things? Maybe it's heart, maybe it's a heart, maybe there's a heart or something. For those of us that are aging, that this is a normal aging process, that they would be agreeable to go taking it one step further undergo whatever the test might be. I have no idea what the dementia test is, but I'm curious: are they understanding when a patient says, "I'd like to be screened for dementia," and then they prescribe recommend or go to someone or someplace to actually have the screening done?
So that's a good question, but dementia is not considered normal. That's an abnormal aging process. So if you, as a loved one or a family member that is concerned about somebody's memory in regards to dementia or Alzheimer's, that would need to be a topic that you would bring to your primary care. I am concerned about XYZ. And then that would further the investigation of what's causing it. So it could be like blood work, labs, more invasive or comprehensive assessments for your cognitive impairment. But for simple cognitive intact status, because as we age, we do lose some of our memory and short-term memory, things like that, but it's normal. So that would be when you go do your annual checkups, that would be your clock test. Sometimes they'll do the clock. Sometimes they'll ask you 3 words. That is just specific to making sure that you can recall things further, short-term memory check. Did I answer your question? So they should be on board with that.
And can I jump in
Not
too?
specific to dementia.
I'm just going to jump in too. I was going to talk a little bit in a few minutes about the Engaged Brains Project.
Yep.
It's an initiative in the area that Dr. Karen Sullivan, Pinehurst Neuropsychology, who is actually trying to do exactly what you're saying. Go out and educate all of the doctors and all of the nurses and the staff to know what sometimes signs are, because sometimes a person might have some kind of a cognitive impairment, but they go to the doctor's office and you're in there for maybe 3 to 5 minutes, and your repeat pattern is maybe 10 to 12 minutes. So if they were with you a little longer, they might have heard you repeat yourself over again. And at that point, they would go, "Oh, I think I need to refer him." So this is where Stephanie is actually saying, be your own advocate. If you can be your own advocate and have somebody with you that knows you, or if you live alone, it's tougher, because if you're the one with the cognitive impairment, it's hard for you to be your own advocate if you're not remembering that you're having a problem with remembering. Right. But if you have a spouse, that's when it's good time to go into the doctor's office with your spouse and say, "I've noticed Frank is missing his words every once in a while, or he might repeat himself," and things like that. And the other thing I'm just going to throw out here is that there's talks that we've done in the past, and we'll do in the future as well, that there's typical signs of aging. You know, the brain, where you walk down the hall and you get to where you're going, and then you're like, "Wait a minute, what was I here for?" And you have to go back to where you were, and then it pops in your head. Well, it's the person that goes back there and it doesn't pop in their head. That's when there might be an issue. Or you forgot where your keys are. Okay, well, you forgot where your keys are. That's pretty normal for most people. But if you don't know what keys are when you're looking at them, you don't know what it is, or it's in the refrigerator, those are the signs that you might think there might be a question to ask the doctor.
Yeah, and that's why these packets would be a great benefit to you, to keep you on track while you're at the doctor, because that time sensitive appointment. Yes, ma'am.
Before COVID, and I went to see Dr. Sullivan, and only because my daughter talked me into it. But it was a baseline to see where I was, when I was a little younger.
Yeah.
So if I ever thought I got Alzheimer's, which my father had, then I had a baseline to say she was here, and it is progressing. So Dr. Sullivan, but what made me think of that was when I went in for my evaluation. I wasn't crazy. That helped. But she said, if you go in, you don't know where your keys are. Or I'm going to this room to pick up my keys. She said to sing yourself a little song on the way to the room, going, "I'm going to get my keys. I'm going to get my keys." And then when you get your keys, you can stop singing. So
I like that idea.
Dr. Sullivan gave me that advice.
I'm going to need that. I'm going to start using that. That's good.
People around here at the office are not going to like that, but I think I'll start doing that.
Thank you, thank you. Ma'am, did you have did your hand?
Women likely to. Why are women most likely to have these disabilities?
The frailty. So, one thing in nursing school way back when, and I will never forget this, women who are short and petite have a higher risk for osteoporosis. And so frailty is part of that. The muscle mass, when you age, we lose muscle mass, which is the reason why we need to work out and lifting just body, like low weight stuff. But that's the reason women. And the hormones that, menopause can also increase that. I know. Thank you.
Yes, you have a question right there?
Yes, sir.
You have a question? You okay?
Okay. I'm Gene Barbie. I live up on number 6, and I have been helped tremendously by the VA. My compliments to them. Matter of fact, your nurse was by to see me today, Tammy, and I think she had a good meeting. I try to be active, even though I'm a young 92. But I'm very appreciative of the help the VA has given me. Thank
That's
you.
awesome. Thank you for your service.
So much. Yeah,
I'm
thank you for your
glad.
service.
Yes, ma'am. Yes.
And they were talking about now they are saying that hormones for people who are going through menopause or about to go is a good thing. Whereas back then, when I was that age, they said that it was not. So my doctor would not allow me to stay on the hormone. And I just wondered what you have heard about this or.
Now, I don't know all about that, but that's interesting because I did not know that, back in the day, that the traditional medicine. Yeah. Yeah. But how time evolves, healthcare is always evolving. So it's beneficial.
It's probably
Wow.
because, like what Stephanie was just saying, is sometimes with menopause, maybe you're greater risk to getting dementia or Alzheimer's. And now, since they've been studying that for so
Mhm.
long, they go down. They go, oh, we should have had these people. They
Yeah.
don't,
The research has shown.
Unfortunately.
Yeah.
I doubt it.
But that's something you could write down and take to your doctor and ask. Yeah. I mean, that's, those are kind of the ideas that you can ask. If that truly is meaningful for you, if there's something that you can do now. It's never too late, I always say. Yes, sir.
First of all, thank you for being here.
Thank you, sir.
If I may ask, are the primary care physicians giving us the information or suggestions before our trips, as far as you know, like your presentation on what can you expect from the visit? And when I go on my annual inspection, whatever you call it, physical, I usually get some note, bring your prescriptions. But they don't say, what do you want to get out of it? And some of those ideas that you expressed, not 12 pages, but maybe just 1 or 2 of them. Basically, what do you hope to get out of it? Are they on board with that, or are you
I mean, they
approaching
should
them
be.
and educating them to ask us those questions?
So am I personally going out into the community educating the providers? No, because I do work in the hospital setting. But the good thing about your role and the reason why you play a vital role in this age-friendly initiative is because you advocate for yourself. So if we don't know, then we can't help.
Sure.
So by writing down some of your concerns and questions, you would be the one to kind of start that conversation with your provider and see what treatment plan or care plan would work best for you and the interests that you
Right.
are
Now,
concerned. Yeah.
I've spoken to this issue before, and that is that your generation is very technology savvy. You mentioned several websites, whatever, click on this and do this
Yes,
and then
sir.
print it out. You're speaking to someone that is self-taught with technology, and quite frankly, we have our difficulties going through the websites in many cases.
Yeah.
And in that poverty level you spoke about, a lot of people don't even have access to technology.
Absolutely.
So I would
Absolutely.
encourage you, and as well as the senior citizen I've spoken to, the center here, is that always include some of those information in printed form for us. And that would help a great deal.
Absolutely.
Again, I thank you for being here. Been nice
Thanks
to
for being
have
here.
some handouts to take home and
Yeah.
try to go through these websites that you spoke about.
Yeah,
Thank you again. We
absolutely.
look forward to you coming back.
Oh.
There may even be a work session on that. What do you want from your doctor's visit?
Yeah, and we can, and certainly can line that up with Lynn and maybe
Sounds
all
like a
sit
great
down.
suggestion.
Yeah, and have a work group. That would be awesome. It's a good
Stephanie
recommendation.
will
Thank
go
you.
through those handouts and she'll figure out which of the pages are the most important. And then
Yeah.
she'll forward those pages to me along with the resources that I can have them printed out for you. Okay.
Yep. Yep.
And is it
All right.
okay if I jump in and talk about some of the?
Yes. Thank
Okay.
you.
No, thank you.
Thank you.
Don't go away. Don't go away yet.
Okay, I'll stay.
Okay, good. All right, so I just wanted to speak about a few of the things that on one of the slides for resources, I just wanted to make sure that everybody knew the difference between a few things. So it said aging outreach services. So everybody in the community has heard of aging outreach, I am sure. But aging outreach services is a registry. Does anybody know what a registry is? Well, what a registry is like a directory of people that want to be caregivers to come into your home. So that's what a registry is. So it's a business. That's what Aging Outreach Services is a business. There's another registry in our area in Moore County, and they're called Griswold. Then we have a list here. It's 3 pages long of licensed and bonded home care agencies in the area. So there's a difference. So the registries are people who are just like you, who want to be a caregiver, or they're younger, or they're a CNA, a certified nursing assistant, and they just want to be on a registry to do caregiving. But we have an actual sheet out there on our Department of Aging table that is a full-fledged sheet on the licensed and bonded home care agencies. So we partner with 2 licensed and bonded home care agencies through our respite program that we provide here. But there are so many. There's like 19 in our area and then some. The other thing I wanted to talk about is where it says Moore County Senior Services. So everybody knows to come here to have fun. Like I said before, it's like the Boys and Girls Club for people over 50. But we are also, our staff work for the county, and we work for the Department of Aging. So if there's a service, a resource, a need that you have, you can call us and we can help with whatever that service is or resource. There are a lot of services that we offer seniors in Moore County for free. Now, yes, when you sign up, they might say, well, somebody in your income bracket might donate back $5, $10 a month to help go put in that fund to help more people. But it's up to you whether you wanted to do that or not. It's okay. These are services through the grants that we get through the federal government. And there's somebody like us in every county across the United States. So if you ever had a need or whatever, a service, a resource, whether it's for somebody here, whether it's for yourself, or whether you have a family or a friend that lives in a different county or even a different state, we can help find you the right person to talk to wherever that is. We have something called a fact sheet, F-A-C-T, fact, and on this is the list, little teeny paragraphs of all of the services and resources that we provide. I'm not going to go into it right now only because I can talk for about an hour on all the services that we provide, and I love it. It's a passion of mine. The one other thing I wanted to talk about too is how many people in the room have First Medicare Direct as their insurance? Okay, so you all got those scary little letters in the mail that said it's going away, and then everybody panicked, and we got about 50 phone calls a day with everybody saying, what can we do? Well, there's nothing you could do now, but between October 15th and December 7th, every year is something called Medicare Open Enrollment. That's when you see Joe Namath on the commercials 24 hours a day. So you don't need a reminder. You've got that reminder. You just call us and we'll schedule you an appointment. And there used to be 3 Advantage plans in all of Moore County. Now there's like 5 full pages of choices. We will find you the right plan that fits your needs, carries the medicines, and works with the doctors and specialists that you already have. So don't worry, we'll be able to take care of you. Yes.
Because it's going away, like over here, you're entitled to go with original Medicare or Medicare Advantage. And because it's going away, they can't refuse you for a supplemental plan.
I don't know whether that does go into the special enrollment plan or a SEP, the special enrollment program. Does that say, Katie? Yeah. If it went away today, that would give you a special enrollment period. Because they're giving you all this time, it does not throw you into that, but it doesn't mean you can't try to get a supplement at this point. It means that you'll be able to, because every year we go through this. Mm-hmm. Possibly, yes. Yes. But if you if you move to another county or if you move to another state, that would give you a special enrollment period because now you're in a different place. That would throw that into there. But because Advantage plans come and go every year now, that doesn't set you up for that special enrollment period, but we certainly will be able to help people. The other thing I wanted to talk about is we were talking about on this slide, so it says Pinehurst Area Alzheimer's Association. We do have people that work with Alzheimer's Association, like Alvita Person is our family caregiver advisor. So she'll have one of the memory walks every year. She does a lot through the Alzheimer's Association. We have a lot of people that come and give, but they're basically, their headquarters are in Charlotte. In Raleigh, we have the Dementia Alliance Association, which is kind of the same, but they specialize more on all the dementias. But with Karen Sullivan, Dr. Karen Sullivan, she has the Engaged Brains Project. It's almost a year now that we've been part of the Engaged Brains Project, and she is having a town hall meeting on Wednesday, August 27th at 2:30 in the afternoon over at the Community Presbyterian Church. There's a flyer in the back on our table that's a twofer, and it does list it here. That will be a great talk because she wants to know if you've had any issues with dementia, with going to the doctors and doctors not questioning, hey, are you okay? Because usually, like even when I go to the doctors now, they'll say, have you fallen lately? That's like a new question that they ask all the time, but they don't really ask about, how are you? They might say, have you been depressed or something? But dementia is something that's, no, pardon the pun, but on everybody's mind, basically. And if you go to the doctor once a year, a lot can happen in a year. So we have that. I'm trying to think if there's anything else that I was going to touch on. But just to let you know, if you have any questions, if there's somebody that has a need in your area, someone that you know that you might feel that they have possibly they're a little bit different than they were before, maybe you can help them as a friend and say, hey, I would like to go to the doctor's office with you just to help you out and maybe take you there or whatever. That's a way to kind of reach out to somebody. But does anybody have any questions for me? I know I was just briefly going a little bit all over the place, but you have a question for Stephanie? Okay. Yes, ma'am.
I have my health care power of attorney and do not resuscitate those documents that you get from your attorney.
Yes, ma'am.
But I had them registered into the Epic system,
Mhm.
and I was wondering if they still do that.
Yes. So
Okay,
that
'cause-
is a thing. Yes.
And I did that, and it really helps because you don't take those documents around with you all the time. And for you to say that when you're in the middle of an emergency, it's what do you mean? Have I got the papers? They're at the house or they're in the lockbox or
Right.
whatever. But I've been able to say it's in the Epic system. You just got to find it. I have it on file.
Yes.
And that has helped me a lot. So if anybody doesn't know about that,
Yeah.
I think that's a good thing to do.
Yeah, thank you for that. That is, yes, so that is still a thing. And what you can do, whether you're a patient in the hospital or you just want to actually leave here today and say, I'm going to do it right now, you can go to the hospital in the main entrance and they'll be, I think did you go to HIMSS records management? So that department, if anybody's interested, do you know where the parking deck is? Outpatient pharmacy, where that truck fell through? Yeah, there, yeah. That's the parking deck I'm talking about. So if you go to the that second deck, I guess it would be, so right below the emergency room, there's an entrance there, and that you'll just tell the folks in pharmacy that you want to go to HIMSS or healthcare records with your documents, and they'll be able to scan that stuff in for you there.
And also, I just want to say that Firsthealth Hospice and Palliative Care, they actually do every year an advanced directives event.
Yes.
Alvita
that's
and
correct.
I are usually volunteers as witnesses, and it's a drive-through event. They provide you with the paperwork. You fill out the paperwork. You drive through. They complete it. There's a notary there, witnesses there. And not only do you get the copies of everything, but then they actually scan it and make sure that it's in that system that you guys are talking about. So the hospital is then updated. And it's a free service, which is wonderful. So that is something that you guys can do, but that's another Firsthealth wonderful program that they have. They advertise that usually in spring. It's usually in April. So in March is when they do that. We usually do a big program like aging in place or whatever it is that somebody can age in their home, all the way through what Firsthealth or palliative and hospice care is, and pre-planning a funeral, everything in between. And usually we schedule that program around the actual advanced directives event so that people will understand what the advanced directive is. They get the paperwork there at the event, and then a week later is when they are going to drive through and present it to Firsthealth.
Is it in your My Chart? Does anybody know, ma'am, do you know if it's in your My Chart? Okay. Yeah.
I guess calling the doctor's office or the hospital and
Yeah.
seeing.
I mean, it's going to be in your chart if you're hospitalized, and so you can ask then, but I'm not sure for the outside of, if you're not hospitalized, can you verify that? Mm-hmm. Right. I would think, I would be curious to know if that My Chart has it or something.
Mhm.
I would think it would, but that'd be interesting to know.
Or maybe just follow up with your doctor's office if
Yeah.
you gave it to them, just to make sure.
Yeah. But, worst case scenario, you can always just take a copy to the health records and have them scan it, and they'll tell you if it's in there or not. Yeah. But I'm not sure on the outside of the hospital if that, yeah. I'm sorry. I wasn't able to answer that.
And then quickly, Stephanie, you touched on it earlier, the HELP program that volunteers might have done at the hospital to help prevent delirium.
Yes.
Can you just touch on what, it's just like basic
Yeah.
stuff, but
So-
it's great for everyone to learn.
Yeah, so the HELP program, it's an American Geriatric Society co-care HELP, and HELP is an acronym for Hospital Elder Life Program. It's an evidence-based program that's been around for 2+ decades that is to prevent hospital-acquired delirium. And what does that look like? So we rely heavily on our, so this is a care model only offered here at More Regional. And we rely on our community volunteers to come in, and they'll go see patients that are considered high risk for delirium in the hospital. If you're interested, Lynn, you have my contact information. Well, you'll go, so if you're interested, you can either go through Lynn, or you can also contact volunteer services or guest services here at More Regional. Cheryl will be more gracious to help you with that, and you'll probably see my face. So I'm over that as well. But it is only offered here at More Regional if you're interested in volunteering.
But it's something that if your loved one is in, because just in case, because right now, do they do it in every single floor in all the departments, or is it just a few?
It's just a few.
So if we
it's-
teach everybody how to do it, then if they're on a floor that it's not practiced, they can help their loved one possibly.
Absolutely. I mean,
Yeah.
family members are always the best advocates and the best teachers for their family members. So there are tips that we can provide to loved ones if you are not the hospitalized patient, that you can help support these protocols or initiatives through delirium prevention at the bedside. Yes, absolutely.
But it's something easy like,
Yes.
Hey,
so
honey.
just talking.
yeah, just talking to them, to try-
Stimulating the brain.
yeah,
is-
clearing the cobwebs, right? So it's simple things. Hi, honey, they
Yep.
just woke up. It's Tuesday. It's sunny outside.
Right.
We're here in Pinehurst. You just had your gallbladder removed and everything's good. You are going to have breakfast in about 10 minutes. It's whatever time it is. So instead of in the past where we used to visit somebody in the hospital and be like, oh, they're sleeping, let's just go away. No, you want to get in there and help clear those cobwebs. Because isn't it true? I think Karen Sullivan had said that sometimes anesthesia can actually live in your body for a year. So if you can clear those cobwebs quick, then maybe there's a really good chance that delirium doesn't set in and you leave with your cognitive ability rather than.
Right. So this would be for patients. So here at More Regional, it's for patients 70 and older, and it's really applicable for our medical surgical units. However, these interventions can be applied at home. I mean, it can be across the care spectrum, honestly. And so it's just simply having a conversation with them. It's for the patients that are cognitively intact all the way up to the advanced dementia, and just having those conversations, just coming in and saying hello, like you would if you were living at home. I mean, it's just like that. It's just in the hospital setting. So it's a very simple, innovative way to prevent delirium in the hospital setting. Yes. Yep. Yes, ma'am. Oh, it is? Thank you for looking. She said it is on her My Chart. Yeah. Awesome. Thank you. All right. Well, thank you, everybody. I appreciate you coming and listening, and I'll work on that work group. I like that idea.
Thank you, Stephanie. Thank you so
Bye-bye.
much.